and then I posted this background into my.
I'll update my photos and tell my friends that I had a nice session.
Actually, today I met two from the Thailand.
Facebook accounts, I think all girls have FB.
Most of the ones that I engage with them are from the Pacific Island countries.
Safeguard.
Today is my favorite session is to discuss about the financial management issues across the ADB project.
If safeguards was a meal, I'll have it last, but I'll probably have procurement first.
Procurement session was quite interesting because they were talking about the new procurement guidelines.
There's a lot of complication in the procurement process, but to be transparent and accountability, those are the key points that I want to learn.
Talking about the safeguard issues, there are different approaches based on geographical locations and so on.
These sessions actually are highly relevant to us because we are about to start a new project with ADB.
Like we can implement any activities we want, we can follow the plans, the policies, but dealing with people, that's the most important part.
The country's experience, we can also find solutions for our problems.
We got an opportunity to ask questions directly to those who make decisions within ADB. Normally, we don't get that chance.
The most interesting thing is I saw how the technology is used for this kind of forums, efficient outcome from the participants.
ADB is very concerned on the environmental and social safeguards.
Very nicely organized, all the presentations, the accommodations.
And the people who I met, like very influential people.
Sri Lanka wishes to have more solar energy.
With the projects that we're getting, I want to make sure we implement them the right way to make sure that it reaches to the people that are in need of our supports and assistance.
But the future should look bright.
Excuse me, we're doing an interview.
Now on its 6th year, the Forum on Successful Project Design and Implementation is happening fully virtual this year. Government representatives are connected online from various parts of Asia and the Pacific. ADB staff and participants from the development community are also online. Organized by ADB's Procurement, Portfolio, and Financial Management Department, the forum seeks to enhance the institutional capacity of executing and implementing agencies in developing member countries. In this forum, we want to broaden our knowledge and improve our approaches in project design and implementation. We learn the guidelines for mitigating project risks during the COVID pandemic. And we also discuss approaches in rebuilding project momentum. The experience of frontliners and cases from the field broaden our options for operating under the new normal. Most important, we learn together and learn from each other, in rising to the challenge of COVID-19 and beyond. Post your thoughts in social media. Use the hashtags, #RiseBeyondCovid, ADBOps. Learn from experts and people in field. Ask questions, share views, and join the game. Finally, meet new friends and connect with counterparts in other countries. Stay safe and stay engaged at successfulprojects.adb.org.
Welcome to the session, Prioritizing the Safety and Well-being of Project Stakeholders. Our facilitator for this discussion is Charlene Joanne Shillingford McKimmon, the Senior Procurement Specialist of the Procurement, Portfolio and Financial Management Department. Ms. McKimmon, over to you.
Thank you. Good afternoon, everyone, and welcome back to the second session of the day. I'm your moderator, Charlene Shillingford McClellan, and I will be guiding you through this panel on prioritizing the safety and well-being of project stakeholders. This session presents the guidelines and case examples of promoting safety and protecting the well-being of project stakeholders, as well as the challenges in implementing safety measures. We are joined today by 5 panelists from procurement, legal, health, and our safeguards divisions. We'll start off with Eduardo Banzon. Eduardo is a principal health specialist in ADB's Social Development and Climate Change Department. He champions universal health coverage and has long provided technical support to countries in Asia and the Pacific. He was President and Chief Executive Officer of the Philippine Health Insurance Corporation, World Health Organization Regional Advisor for Health Financing in the Eastern Mediterranean region, the World Bank Senior Health Specialist, World Health Organization Health Economist, a PhilHealth Vice President for Health Finance Policy and Services Sector, and a faculty member of the University of the Philippines College of Medicine and Ateneo de Manila University Graduate School of Business. Eduardo will be followed by Jenny Chu. Jenny is a procurement specialist in the ADB's Procurement, Portfolio, and Financial Management Department. She is the focal for various ADB sovereign operation projects in Southeast and East Asia, and she leads the work on strengthening the environment, health, and safety requirements in ADB procurement documents. Ms. Chu is a chartered professional engineer and an admitted barrister and solicitor of the High Court of New Zealand. She has over 10 years of experience in project planning, design, and delivery of complex infrastructure projects. To join in with a legal perspective, Jenny will be followed by Koichi Takei. Koichi is the counsel and procurement focal point at ADB's Office of the General Counsel. He has over 17 years of professional experience in procurement for development assistance projects, particularly in Asia and in Africa. He provides advice on procurement policies and rules, response to bid protests, and resolution of contract disputes. Prior to joining the ADB, he held senior procurement posts in the Japan International Cooperation Agency, JICA. Mr. Takei is a Japanese national and holds a Master of Law degree from George Washington University. He was admitted to practice law in New York in 1997. Our 2 final panelists today will be speaking on safeguards. They join us from our safeguards divisions. Felix Oku will be the first. He is a senior safeguard specialist in ADB's Sustainable Development and Climate Change Department. He's a NEBOSH qualified construction health and safety specialist. He's also a chartered professional member of the Chartered Institution of Water and Environmental Management and UK Society for the Environment. He has over 20 years of multi-sector professional safeguard experience with multilateral development banks, international private consultancy, and the UK local government. Prior to joining the ADB, Mr. Oku worked as a social and environmental safeguard specialist for the African Development Bank and the World Bank. He was also an international environmental and social due diligence consultant with WSP UK. And finally, Sangara Gajasinghe is the Safeguards Officer in the ADB's Sri Lanka resident mission. Prior to his current assignment, he worked as a social safeguard specialist for ADB's water and transport projects and for the World Bank's Climate Resilience Project. Mr. Gaja Singhe has a master's degree in integrated water resource management from the University of Peradeniya and a Bachelor of Science degree in agriculture from the same university. He is a member of various professional organizations in Sri Lanka, including the Institute of Environmental Professionals, Highway Engineers Association, and Agricultural Engineering Society. I welcome all our panelists. Thank you so much for joining us in this very important discussion. We start off our discussion this afternoon with a presentation by Eduardo Banzon. Eduardo, you have the floor. Please go ahead.
Thank you, Charlene. And I'll be talking about COVID-19. Can we have the next slide, please? So, Adam, can you have that? So COVID-19, it's quite interesting this year. When we started the year, we started hearing about a coronavirus that was, in a sense, creating problems in a number of hospitals in China. And now, as we look at the latest numbers, and I just got this morning, we're now seeing that COVID-19, which is how we now call the disease that was caused by the coronavirus, has already caused 6,000, has affected 6,000 per million people. And in Asia, and half of it is coming from Asia. It is also a disease that has quite what we call a high case fatality rate. Globally, 160 out of a million people have died. People in Asia are surviving it a little bit better globally, but it is still, in a sense, has a higher case fatality rate than a lot of the other infections that has probably the same level of prevalence that COVID-19 has. Next slide, please. And we could see it in the absolute numbers. Again, I just got this morning. More than 50 million right now has been confirmed to have COVID-19. Now, the number is probably higher because these are only those that has been tested and confirmed. And we have to acknowledge that a significant number of people that has COVID-19 or the coronavirus have not been tested. The deaths is now 1.2 million and rising. Good news is that there are people who are recovering, but this is, in a sense, really a pandemic, an epidemic, a communicable disease, which is quite difficult to manage. Next slide. Because there is really no vaccine at the moment, despite the reports that came out the other day, nor is there really a treatment that you could use, for example, on a outpatient basis. We every day in our lives, okay, wherever we are, communicable disease is part of it's there. We all have a cough, we all have a cold, probably somebody suffered an upper respiratory disease and all that. Historically, there's been a lot of other communicable disease. Tuberculosis is something that the developed world have addressed, still a problem here in Asia, and the list goes on. And frankly, the challenge for communicable disease is when we cannot treat them or we cannot find a vaccine against them. And vaccine is something where you build immunity against that. Because in the absence of a treatment, in the absence of the vaccine, well, the most really that you can do is to make sure that you don't get it. So with COVID-19, we have seen rapid development in the last 9 months, the last 10 months, and hopefully we have a treatment that will soon be convenient to give, that means on an outpatient basis, or a vaccine that could help people get immunity. Until then, the best way to address COVID-19 in the workplace, in order to ensure safety of everyone, is to understand what it is. So, what is this virus? Okay, so it's spread from person to person. It's not spread with blood, which is like HIV/AIDS. It is not spread through the gastrointestinal tract. Okay, so there are infections that what we call the oral fecal route. COVID-19 basically is what we call a droplet infection. That means it spreads between people who are close contact with each other, and usually when respiratory droplets, this is so when you cough or even when you talk, when you sing, and then it comes out and it lands to the mouth or noses of people who are nearby. So you have to understand this spread, because when you have an infection where there is no treatment, this is how you manage it. Now, what is, not good with COVID-19? Well, there's a lot of things not good there. But unfortunately, unlike a lot of other infections, where the transmission, the spread will only happen when the one who has the illness presents symptoms. That means you could avoid that person who is coughing, who has a fever, all that. We have found out now that this can be spread even with people who do not have the symptoms, whether they're pre-symptomatic, that means they will eventually have the symptoms, or they're asymptomatic carriers. That means they will never present the symptoms, which means we could not use an approach which we use in a lot of infections, that we stop the symptomatic. That means we screen the symptomatic. We can still use it, okay? That way I have to correct myself, but we have to acknowledge that there will be people without symptoms that will pass through the screening process. That is why, next slide. How do we address COVID-19? So that means in the workplace, we have to design the workplace that people avoid close contact. And this is both at the individual level, that means people are actually avoiding it. At the same time, there are actions, there are measures that are put in place so that people will avoid the close contact. In addition to that, there are, of course, health systems actions, which is what we call the testing, tracing, isolation, and treatment. But you could treat the sort of the symptoms, but not the virus itself. And of course, vaccines. Next slide. Let's focus on the close contact. So what does it mean? That means we have to design the workplace where people can avoid what we call the 3 Cs. And this is a nice thing that came from Japan and easy to understand. Avoid closures with poor ventilation. That means workplaces should be, as much as possible, the ventilatory system, aircon system, should be addressed. If it can be opened up, that would be best. Though the more open your workplaces are, the better it is. Avoid crowded spaces in public. Okay, now this is a challenge because for public transport, that's crowded. So how would we manage that? And finally, avoid settings where you have close contact settings. That means when you talk, you try to avoid people talking to each other, converging together, going to events. So these are the 3 Cs. At the same time, what I call the 2 Ws: wear face masks, in particular, not because you're avoiding an illness, but because just in case you are sick, you don't spread the disease. And of course, always wash your hands. So imagine in a workplace, in order for us to control COVID-19, we have to make sure that it facilitates the 3 Cs. At the same time, there are ways in which face masks happens. Either you mandate it or you provide incentives for people to do it. And of course, you have to make sure that there's enough places where you could wash your hands. Next slide, please. So in addition to individual actions, as I've said, you need to have government actions. I talked earlier about the testing, tracing, isolation, and treatment of vaccines, and that should always be part of government actions. But one thing that's sort of missing in a lot of developing countries is that when you start talking about this testing and tracing isolation, that means when you put somebody in isolation and not ill enough to be in hospital, that means that person will be working for a couple of weeks or even more. So there has to be mechanisms like paid leaves to make sure that there will be no disincentive for people not to have themselves tested because they don't want to lose a time for work. At the same time, as I said, there should be government action to support the individual actions of the 3 Cs and the 2 Ws. There should be watch points and all that. Finally, of course, in their settings where we also need, of course, to understand that in all of this, government may sometimes really impose strict rules to ensure that crowded space, close contact setting, and closed spaces do not happen. And then that means we have to manage and find that balance among these measures and, in a sense, opening up the economy. Next slide. So what have we seen? So sorry, the one in the left would be how it was. So this is internal movement, and we picked this up. There was a review of policies of countries. If you are red, that means you're very strict. If you're green, it's opening up. So we saw that in June, a lot globally, including Asia, a lot of countries were restricting internal travel. This was to avoid closed spaces. This was to avoid people from having close contacts. It's now much less last October. We see more greens now, and hopefully this continues. But of course, what we're hearing, and I'll probably discuss that in a while, is that there are now a rebound, a second wave that we're seeing in countries. And probably if we check this by the end of this month, we'll probably see more of the reds. Next slide. Public transport is important for a lot of countries. If you cannot go to work, if you don't have a way to get there, how can you work? So it was not as bad. Okay, sorry. The green is red. The green is that means there's no measures. Red is much more stricter. So we have seen in May a lot of countries stop public transport. The red is really, it's really very strict stop. We're now seeing more of greens. That means countries are opening up public transport. Countries are also becoming more savvy in how to allow public transport while making sure that close contact, remember the key part that we want to avoid the spread of the disease can happen even if public transports are available. Next slide, are open. So we've seen stay-at-home requirements. Of course, if it's stay-at-home, then how can people work? It used to be really all red before. That means it was very required. Now we're seeing less. Don't even see any of the reds right now in any of the countries. So in a sense, countries are find this middle ground on how to get people out of home to start moving and doing work while making sure that they could control the infection. Next slide. And this is basically this workplace. And as I said, if you look at now, countries have really opened up the workplaces now. The next slide. Now, one of the things we've seen, of course, with COVID is Asia is actually doing a good job. If you look at the slides, this is cases per million. If you look at all the way to August, September, it was probably India, and probably even the countries where there was increase in cases, they have actually controlled it now. By October, we're only seeing Nepal having a problem, but most of the other countries, basically, there were increases, then it went down. What's quite interesting is countries like Sri Lanka, the Greater Mekong, countries in the Greater Mekong, the Vietnam, the Laos, and Cambodia, basically in Thailand, these developing member countries of ADB basically were able to control COVID-19. But last slide. And I like to show this slide because this is Europe, okay? And what happened in Europe is after they have the spike around March, April, they were able to control it. But then what are we seeing now? A spike again, because they started opening up. Probably some say too much opening up. And this is what happened. And so this is probably a warning for Asia. We're doing a great job. As I said, either the countries have controlled it so well, or countries that has cases have been able to bring it down. But we have to be careful, because the moment you stop a lot of these measures, the 3 C's and the 2 W's, we might have something like this again. Thank you. And let's all keep safe. Over.
Thank you. Thank you very much, Eduardo, for this insightful presentation, helping us understand the spread, sharing the best practices, both on individual actions as well as government actions, and of course, finally, for showing us the global picture of infection, internal movements, transportation, and of course, this resurgence, which is obviously quite concerning. Before I pass over to Jenny, I would just like to remind all participants that we do have a Q&A section towards the end, so you can, we invite you to put your questions in the Q&A box, and ask them there, and of course we will present them on your behalf to our panelists who will answer in the very last session. All right, Jenny, please, I invite you. You have the floor.
Okay, all right. So good day, everyone. It's a pleasure to join you here today. Over the next sessions, I would just want to touch on some guidance that we provided for borrower in terms of how to deal with issues associated with mobilization and remobilizations of contractors and consultants, and ways to address COVID-19 health and safety risks in new procurement and contract implementation. Slide. So the session will largely cover a bit of context and overview of why we're giving this guidance, the concept of health and safety management plan, and some key points to consider in our guidance on this topic, and some things to bear in mind when you have the role of the borrower in the form of the employer or client in a contract, and lastly, where you might and when you might want to call for extra support and getting some resource to help. So as the employer or client to the contracts, as a borrower in this case, in particular focusing on works contract, you should understand your own obligations and also obligations of your contractor under existing contracts, and require them to put in place appropriate organizational structures and develop process and procedures to address different aspects of managing and addressing COVID-19 risks as per the relevant contractual clause. This is very important for your own duty of care and also organizations' reputation risk as a client. And we understand that life goes on during COVID, and it has different impact on different kind of contracts. Some of them might have been pulled, some of them might have been downsized, some of them carries on. So the purpose of this guidance is to advise how you might deal with this different sort of general scenario in contractual planning and also implementation. Obviously, if you have any case specific query, then you can consult with your project officers in ADB, and they can get extra support if it need be. But the particular scenario that we'll be covering in the advice that we are giving today will be as follows. So we'll talk about what to do and what to bear in mind when you're dealing with remobilization of contractors, no matter whether the contract's paused or the contract has continued but downsized, and now you need to sort of increase the workforce on site back to the full force again. How do you deal with bidding document that's already been issued and currently in the market but hasn't come back yet, or those that come back already? How do you deal with, or what are the provisions to consider that you can add in new bidding document to be issued by amendment? And what would be some of the useful provisions to introduce in the loan consultant recruitment, in particular, the terms of reference of new supervision consultant? So the key concept is that through the COVID-19 specific health and safety management plan in the contract, this is a way that you as employer or the client can have some assurance that the contractor has some reasonable steps and procedure in place to mitigate health and safety risk in this particular situation. Health and safety management plan is something that is required under the ADB sort of standard contractual conditions already, and it's also has a role to play under the safeguard requirement as well, as illustrated by this diagram that is sit under the environmental management plan. But what we are highlighting here, and a key principle in our guidance, is that the health and safety management plan that you've already prepared or the contractors already prepare for the particular contract should be up to date to be adequate enough to address the health and safety prevention controls required by the country in the COVID-19 context. And then that needs to be done by the contractors and approved by the engineer or the employer, depending on the contractual delegation. So now moving on to some of the key points of what to keep in mind in existing contracts and what to keep in mind in new contract as in the new bidding document that's going to be released or sort of in the market. So the key point in terms of our guidance for existing works contract that's already underway is that the health and safety plan needs to be updated. We have a particular role matrix that's prepared on what should the contractor do, what should the clients do, what should the supervision consultant, who's normally taking the role of the engineer or the project manager, depending on the type of contract, do, and the role of ADB as well. So we'll get onto that in details a little bit later. In terms of assurance that ADB would like, we would like to make sure the borrower has communicated to the contractor to make sure these COVID-19 health and safety plan updates in place, and the particular review and clearance steps by ADB is based on the safeguards risk assessment, which my colleagues from STCC might touch on later on. In terms of existing contract, what does this mean in terms of contractual claims? It really depends on the particular provisions that is in each of the contract, and it needs to be sort of dealt with and looked at on a case-by-case basis. In terms of new contracts and new bidding documents that has already released or to be released, the key point there is to make sure that in the bid the contractors, the bidders provide, there needs to be adequate COVID-19 specific arrangement on how the contractor will manage the health and safety reflected in the methodology, in the bid price, and also in the program, so that you know before you sign the contract that the team you're recruiting can cover and is competent enough to manage the risk, so that there's no ambiguity. How do we deal with that assurance? Vary depending on the stages of procurement that the particular bidding documents in. And we will touch on to that. It might be via new provisions when the document is not yet released. It might be via addendum when the document is already out in the market but not yet due back. It might be via contract finalization discussions when the documents already, the bidding documents already out and the bids already back. We would try to avoid having to deal with variation later on, but if all the bid evaluations already concluded, that might be an option as well. But fundamentally, we want to make sure that both parties, the employer and the contractor, is clear about who is doing what in terms of COVID-19 health and safety, and what does it mean contractually before the work carries on site. So that's the key point in terms of works. You might then ask, what does it mean in terms of the template that we have got for the standard bidding document for works contracts? So on that front, we have revised some wordings in the standard bidding document. It's largely grouped into two particular areas. The first area is around bid submission and evaluation, and the second area is on contract requirement. So in the bid submission and evaluations area, the provisions that introduced in this particular situation is to ask for in the technical proposal submissions a new COVID-19 specific health and safety management plan as part of the bid, and it gets evaluated on technical responsiveness to make and to ensure that it is adequate based on country-specific requirements, and also there should be a line item highlighted in terms of environmental health and safety compliance in the bid price form as well. The principle there is to make sure that you have a chance as an employer to assess that the contractor you're about to bring on board has thought through what might be the COVID-19 specific risk associated with the works on site, and you have a chance to kind of assess that through their submissions. So that's on the submission and evaluation part. Now, the second part is around contract requirement. As I mentioned before, health and safety management is already something that is required under the current contractual arrangement. But what we have done in this new template is to make it more visible and sort of like strengthen that there's such specific health and safety management that needs to be submitted within a defined time frame in the contract, and no objections required from the either engineer or project manager as per the contractual delegations within that time frame before the work can commence. And also in the specification employers requirement sections, if there is any country specific regulations or requirement on COVID-19 health and safety management, we would encourage the borrower to put that in the bidding document as well, so that forms a clear and transparent basis for the bidder to submit and prepare the response to, and for you to evaluate the submission based on as well. So those are some of the key changes that we have made in the standard bidding document for works contract. And is applicable to works, but we have not made any change to the goods contract. That's still based on the assessment on a different level of risk in this context. If you want to get a copy of this new template, you can obtain that from your ADB project team contact, and they'll be able to provide information to you. So after we talk about works, the other point I want to just touch on quickly is what to do with consulting services. And that is funded by either loan or grant. So under the existing consulting services, the same advice follows that the consultant should adhere to country-specific COVID-19 regulation or legislation as required by the client, which is yourself, and will encourage both the client and consultant to explore non-travel alternative, such as using video conferencing and virtual means of meeting rather than travel if necessary, based on the risk on site. And if there is any additional resources and equipment to mitigate those COVID-19 health and safety risks that was not foreseeable at the time of contract signing, the client should be flexible in assessing the claims in those regard. Again, it's on a case-by-case basis, but something to bear in mind that whether the consultant would have been able to plan and predict for what they would need and what they would need now. So that's sort of things to bear in mind for existing consulting contracts. For new loan consulting service contracts, we've identified that one of the highest risk consultant profile would be the site work supervision consultant. And that's assignment that require frequent site visit. As such, we have suggested some health and safety specific responsibility that we would encourage you to consider adding in the terms of reference of the consultant that is responsible for construction supervisions, so that there's clarity at the time of advertisement before they prepare the proposals. So now just we're going to touch on what does it mean for you as the employer and the client. So for the first scenario that we talk about, for remobilizations of contractors, whether the work has been paused or carried out but downsized, when you remobilize for works on site again, we'll suggest the contractor to submit a COVID-19 specific health and safety plan. It can be updated to the existing health and safety plan, but to the context of COVID-19 based on country specific requirement. Or in the absence of that, ADB also has a good practice guide, which is released by our STCC department that you should consult and refer to as well. And then submit that plan to the site supervision team for review and comment. Then moving on from left to right, the supervision consultants will review that plan and return for comment or amendment, or if they agree with that, send to the employer with recommendation to approve. The employer will look at the recommendations from the consultant, either send a formal notice to approve or return with comment. So all of these sort of like back and forth process on the COVID-19 plan submission, review, and clearance, that is to be dealt with between the contractor, the supervision consultant, and the employer, because technically the party to the contract is between the contractor and employer. So I think a point to stress here is that ADB in no means is the party to clear or approve that the plan. The responsibility for approval of that health and safety plan needs to come from the employer organization. Then the next row, after that plan has been accepted or no objections already been confirmed, then after the getting the approval, the contractor can remobilize and implement the plan by the responsible health and safety officer on site. The supervision consultant will monitor and make sure that that approved plan is implemented as per the version that is approved. And on site, the consultant, for example, carrying out site audit or inspection, will need to also comply and follow the instructions of the contractor's responsible health and safety officer as well. And that also applies to any personnel from the employer side, from ADB or any other organizations that's coming on site. They go into the contractor site, the contractor is responsible for making sure the approved health and safety management plan is executed, and all the visitors needs to follow that instruction from the responsible contractor personnel. So now, if we're dealing with newly issued contract, but before the contractors mobilize on site, the key thing to check is if the contract has already been issued with COVID-19 health and safety amended provisions. If not, then discuss with ADB as to what the actions required to, I guess, align understanding and sort of clear out any ambiguities. It can be through contract finalizations discussion, or depending on what stage of the bid submission is at. If the bid submission deadline is not yet lapsed, then it would be a good idea to issue an addenda with those new provisions in the bidding documents. So that's something to think about in terms of the contracts. For bid received before 31st of July 2020, I know that that's already way past, but contracts not yet awarded. But if you have any of such scenario where bids already received and you're now maybe still in the evaluation stage, I hope not that many, but that might still be the case, then we would still advise you to address the COVID-19 related health and safety requirement through a contract finalization discussions with ADB's no objection prior to that, to make sure by the time you award the contract, the contractor knows that dealing with COVID-19 related health and safety risk is part of the scope, and is also inclusive in the contract award price. So the purpose is to achieve clarity before they start work on site, to avoid any sort of claims or related discussion later on. For new bidding document issued after end of July, I mentioned before there's revised wording that is available from ADB on what you can put in terms of bid submission and evaluation, as well as contract requirement, and that can be issued as a clean document or as addenda depending on the stage. And I've also mentioned for in terms of adding to the health and safety scope of the supervision consultant's terms of reference for loan consulting recruitment. On the screens are some of the health and safety related responsibility that would suggest you to include in a TOR, that the supervision consultant will have a role to play, a very important role, to review those site-specific health and safety management plan, and also communicating that to the different parties involved, and also monitoring it during the execution of the contract. So that's kind of the key thing to bear in mind for works that's existing, new work that's about to begin, and when you're recruiting for loaned construction supervision consultant. Finally, in the last two slides, I just want to maybe highlight a few points to note and also conclude on how to get extra support. So the health and safety COVID-19 specific advice I've just mentioned before is focusing on works, doesn't apply to good contracts because of the relative risk. Obviously, if you want to apply them to good contracts, then you should consult with your ADB project officer, and then they can look at it on a case-by-case basis, or they can consult with the procurement team and to look at whether there's a good idea to apply across. But generally speaking, the advice is focusing on works only. And also just to reiterate that the approval or rejection of the health and safety management plan is the responsibility of the employer, which is between the party to the contract. ADB does not define or mandate specific content in the health and safety plan, other than making sure that this process of updating the health and safety plan to make sure it addresses COVID-19 specific risk is in place. There's good practice guidance on what is international good practice, and that was issued by our colleagues in SDCC. And that should be referred to in conjunction with also looking at the country-specific requirement. So I think the last point I would just mention is that there's many different scenarios at different contracts, and the different scenario that I've just sort of highlighted briefly in this session are just some of the broad category. There will still be case-by-case assessment and case-specific advice to be sought. So if in doubt, just get in touch, and I'm sure our ADB team is happy to help. So lastly, speaking about getting help, we thought two particular areas that you might require extra subject matter expert support will be around dealing with the contractual issues arising from the requirement, and also assessing the health and safety system and the management plan getting developed on organization or projects level. If you need help on these particular areas, please get in touch. They are very important in the current context, and is also a good opportunity to get it right now on projects to make sure that other projects to come will also be set up correctly and properly, leading to successful delivery, which is the theme of this forum. So I think I'll end it there, and if you've got any questions, happy to answer that later on.
Okay, great. Thank you so much, Jenny, for such a comprehensive presentation. And I can see by some of the comments and questions we're getting, there's a lot of interest in this topic. So we're going to get back to it later in the Q&A. Well, I will just like to invite now Koichi from our legal department, and I will place a question to you. Do you have any comment from a legal perspective on the procedures required under the guidance, the ADB guidance on COVID-19 health and safety? This is in relation to work and to service contracts. Please, Koichi, you have the floor. Koichi, we cannot hear you. Yeah, there's a. Yeah. Okay, thank you very much. So while we are trying to get Koichi online in terms of his volume, I will just share a comment that came in on the Q&A. This is someone from Singapore, and this relates, of course, to Jenny's presentation. And the participant is sharing that here in Singapore, remobilization of contractors to project sites needs to be approved by the government and will follow the basic requirement of monitoring all construction personnel, swab test, and PCR every 2 weeks. So we're hearing that this is done obviously differently in different jurisdictions. But Jenny, you did point out that there is, of course, international best practice, but also government rules and procedures, and of course that this is to be approved by the employer or the engineer, depending on the contract stipulations. So just sharing this this comment, this interesting comment in there. I think we have Koichi now, who is ready. Koichi, I give you back the floor. Shall I repeat the question, or do you have it?
You don't have to repeat it. I got the question.
Okay,
thank you,
wonderful,
Shirley.
wonderful, thank you.
I'd like to add one thing with regard to the possible contract adjustment during the contract finalization in the event that the bidding documents are advertised before 31st of July 2020, the issuance of this guidance, and then the contract is awarded from now. In this case, the employer must discuss with the first ranked bidder any potential adjustment to the contract necessary to reflect the COVID-19 related mitigation measures as required by the guidance. If the parties agree that preparing and implementing a COVID-19 health and safety plan is cost neutral, that's easy. The contract only needs to add the requirements on COVID-19 health and safety measures to the contractor's obligation. However, if parties agree that it will result in a price increase, then the employer has to consider whether the contract price will be increased at the time of contract award or through a variation order later. If the contract price is increased at the time of contract award, there will be a discrepancy between the bid price and the awarded contract price, and both of which are generally disclosed to the public, including the unsuccessful bidders, depending on the public disclosure requirements in the employer's country. So the discrepancy might unnecessarily create a doubt on the propriety of price increase during the period between the bid submission and the contract award, unlike the price increase by way of contract modification subsequent to the contract signing. So the employer should be mindful of this difference, considering how to execute the contract price increase when necessary. I will stop here.
Great, thank you very much. Just clarifying, Koichi, were you done with your response?
Yes, I'm done.
Okay, great. Thank you very much. So now moving on, I would like to invite Felix Oku to talk with us today about safeguards, prioritizing the safety and well-being of project stakeholders. Felix, I give you the floor. Thank you.
Yeah, thank you very much, Shali, and thanks for the earlier presenters that made the presentation. I think my presentation is going to be a good straddle between the procurement colleagues and then the health sector group, because the safeguards is what brings everything together, really. Of course, the legal side as well, implications to it. There are quite a few of them that I will have to skip through because Eduardo has done some fantastic job on explaining how the virus spread. And then we've also heard consistently from Jenny, a key document in the safeguards, which is health and safety. But this slide that you're seeing just tells you what happened to our lives from March. We had our lives, people had holidays planned, project sites to visit, and bang on, COVID had other ideas, it came on. And up to then I could only say the 3 C's and the 2 W's that Eduardo mentioned, which is, was deemed to be the international good practice, which we in SDCC reached out to the WHO, and we worked together with the health sector group to bring, organize a webinar and tell the our project teams that had gone into lockdown what the spread or what the prevalence of the disease was in Asia, as Eduardo has explained, and the good international practice on how to come across, how to manage it. Physical, social distancing, respiratory hygiene, and then basic sanitizing conditions were the ones that were proposed. But within it, we knew that our capacity within the capacity of our DMCs, project teams, and the companies would require some kind of development. This fantastic green book called the Safeguard Policy Statement is what guides whatever we do in ADB as far as safeguards is concerned. And both Koichi and Jenny had mentioned severally the borrower's responsibility or the client's responsibility, maybe for want of better words, our development partners' responsibilities. And in those documents, it clearly states that it's the responsibility of the borrower or the client to make sure there are safe system of work, workplaces devoid of physical, biological, chemical, or any other hazards that will be in the workplace. Typically in any project, there is environmental and social impact assessments that are done. And within it is the environmental management plan. And a key component of the environmental management plan is a project health and safety plan, which Jenny mentioned consistently. I think Koichi also just mentioned it. So we looked into it, and then we had to look at specific paragraphs that relate to occupational health and safety and the borrower's responsibility. And then these are all references to those key things. Within it, it makes reference to good international practice. And for those of you who are familiar within the terminologies or jargons or key instruments that we use within the safeguards community, is the World Bank Group Environmental and Health and Safety Guidelines, which is referenced in our safeguard policy statement. It talks about health issues, occupational health issues, but it doesn't specifically talk about COVID. And so the approaches that were within it couldn't serve as international good practice, but that was why we reached out to the WHO. Within that time frame as well, we knew other sister agencies had also put out some good practices out there. And what we did was to make sure we bring all these together and to inform our next course of action. Way back in April to May, our first course of action that we needed to do a risk assessment of our workplaces. And the spread of the disease as well was quite very variable within our region, Asia and the Pacific, whereas maybe it all originated from probably China. China had advanced the management of the disease. Our Pacific colleagues closed the borders quite very early, so the prevalence has also minimized. As we speak now, we have South Asian region being on the ascendancy. So management or risk assessment in the workplace was critical. And the framework we use is what most health and safety professionals were quite very much aware of, the likelihood of a harm happening. And if that harm happens, the consequences or severity of its harm on an individual. And based upon the available information at that place, we thought the risk could be from moderate, low to medium, which requires that for project sites that was closed down as a result of COVID restrictions, if they're looking to reopen, then we need to do a risk assessment and check whether the health and safety plan that was on the site will be robust and adequate enough to address those risks going back to site. And I'm mentioning the three key things that were given to us: physical, social distancing, respiratory hygiene, maintenance, and then the other one, sanitizing and other bits that Eduardo also mentioned ahead of us. Within it, the WHO released a risk management approach or a risk assessment approach, which sort of categorizes typical workplaces into low, medium, high categories. You could say it was a little bit maybe biased towards a healthcare working environment, but we thought the approach could also be applicable to our normal working environment. And within that, we were able to use that approach to instruct or require our operations department teams to reach out to our PMUs, executing agencies, implementing agencies, to notify them of the requirement for them to risk assess their project sites and check whether their health and safety plans were adequate to address the risks from COVID, especially if you're looking to reopening sites And that was done. To inform that, we came out with a guidance document. This is a public guidance document. So the link is there. I think we'll share the slides after the presentation and people can download it. But it gives the approach to risk assessment. It contains a flow chart which basically requires that before you reopen your website, look at the types of work that you're doing, the stage of the website in terms of construction, the number of people who are coming onto the site, proximity of people coming too close within the physical or social distancing regime, and see whether there is a need for you to update your health and safety plan. Inevitably, I think most project sites had to update the health and safety plan. And that health and safety plan would need not come back to ADB for clearance. And I think Jenny had mentioned that severally, so I won't go into that further. But most importantly, it meant that workplaces had to re-engineer their work, because some workplaces could not go on if you're maintaining physical or social distancing. They required 2 meters or more. And some workplaces as well would have to be changed. And then the introduction of, so many other things to make sure that those international good control measures are maintained in place. To ensure this is quite very effective, it means that it's not just our PIUs, but internally in ADB as well. We've issued a good practice note, which Jenny also mentioned, to inform our own project teams that also similar exercise needs to be undertaken within the ADB. And especially for new projects that we're now preparing, we must then consider COVID risks as part of the new risk assessment framework in the environmental impact assessment, so that we will make sure that project sites that will be approved going forward will be COVID site resilient in the absence of any clear-cut vaccine. So that then brings us to the approach that we sort of explained in the framework, that for every project work that has any adverse environmental or social impact, you're typically going to have an environmental management plan. This management plan typically covers the entire construction phase to the operation phase of the project, and it goes sometimes throughout the decommissioning phase. An integral critical component of that environmental management plan we call EMP is the health and safety management plan. And that was the one that we were requiring our PIUs or EIAs to update. There were some projects that we would classify as a category C. So probably prior to the lockdown situation, they didn't require an EMP. But now, because of the nature of work and the maintenance of physical distancing and other international good practices, it would require that they would have to look at it one way or the other, and make sure that national requirements are also included as part of that risk framework was also considered, and that was also cascaded in the guidance. Both two pieces of guidance that sort of were issued. Following the issuance of the guidance, we came out with various options within which our executing agencies and implementing agencies could implement the guidance. And one of the options was, depending upon the stage of the project works, how big your project site is, you could update the EMP. Critically, if the health and safety plan on the site has been done, then that's okay. That was our option one. Option two was you could do a corrective action plan, and then from a corrective action plan, because of COVID arising on the website, and then bring the project back into what we would say an EMP compliant status. And that was also considered. I think the one that was probably maybe most popular was the third option, that project teams notified executing agencies and implementing agencies via notification letters, requesting them to update the health and safety plan. And then in the response or acknowledgement email response, they would then confirm when that update is likely to to be undertaken, so that we know that that update has happened. And then in all of this, we're gonna use what we call our usual monitoring reporting schedule to assess effectiveness of that health and safety plan on that site following the update. To mention again, I think Jenny also mentioned that there was no specific disclosure requirement to the health and safety plan, because that was related to the site. Of course, there are disclosure requirement to the schedule monitoring report that will come as either a yearly monitoring report or a biannually monitoring report, quarterly monitoring report. That will be subject to our disclosure requirement. We again emphasize that this is a time of working together. If nothing at all, COVID has shown us that we can only be stronger when we work together. And as SDSS, we reached out with a lot of support. We work with a lot of the operations department. We're able to organize a lot of webinars with, for instance, our colleagues in the energy sector in Southeast Asia, operations department in the PAD region, and some other regions. We went around all the operations department trying to make sure this cascading responsibility has been clarified, and that was done. We also made sure that there was some reasonable budgetary allocation made. Inevitably, where some of the guidance that we've issued was in English, but the most predominant language within some of these remote places that our projects are located is not English. We're happy to help with translation of those pieces of guidance. Overall, I think the guidance has gone quite well. We've had a lot of interest and questions in it, but again, we're quite happy to take more questions after this one. I would like to then end here and then hand back over to Charlene.
Thank you very much, Felix, for this another comprehensive presentation. And I do want to share with our panelists today that there's a lot of interest in your presentations. Participants are asking for copies of the slides, which they would like to have afterward. And there are also many interesting questions which have come up for each of you. Again, as I mentioned earlier, I will field those in the last 10 minutes or so of our program today. However, I would just like to share a few before I pass over to our final presenter this afternoon. One of the key, I would say, important comments or questions that came up very early in our presentation today was how best to set up consultations with stakeholders in a COVID-19 situation where there people live in places that are already economically difficult and they're in very difficult conditions, and how to mobilize them effectively. I think this is perhaps a general question that we can get answered towards the end. In our broad Q&A, and perhaps more than one of you could jump in on that. There was a question also coming in, and I think Felix just answered that question. It was on the health and safety management plan, and can it be included in the EMP? And I think you pointed that out as one of the first options possible, and you can always detail on that further to answer that question in the session later. There are questions relating to travel restrictions and our use of maybe local experts as opposed to international experts, and how do we maximize locally available experts. And there are questions related to whether what the ADB is doing in terms of making our procurement all online and electronic. And we are doing quite a bit in terms of that, making systems like TenderLink available to our executing agencies. So I just wanted to share some of these questions, which we will take in later during the Q&A, but I wanted to give our panelists a sense of how your participants are engaging and how they're feeling and what they're thinking right now in this session. Now, without further ado, let me invite Saranga to give our final presentation of the day. This is called Conducting Public Awareness and GRM During COVID-19 Pandemic, an example from the iRoad 2 program. Saranga, you have the floor, please.
Thank you, Charlene. Good day to everybody. I'll go through some examples and experiences on how public awareness and GRM was conducted during COVID pandemic using one of the major projects funded by ADB in Sri Lanka. The project is Integrated Road Investment Program 2. Okay. So in a nutshell, this integrated road investment program or iRoad 2 commenced in northeast, Uva and western provinces in Sri Lanka, and around or more than 3,000 kilometers of rural roads and national roads are to be improved and rehabilitated with the objective of having or improving a better connectivity between rural villages and socioeconomic centers. Now, there's a bit of a beauty in this project. From the beginning, the public consultation or public participation was considered as a main key for the success of the project. So there are two keys points which needed to work out. That is, one is on context sensitive design, and the other one is grievance redress mechanism, where public and stakeholder participation was required on an extensive basis. Now, you can see some photographs taken during the previous projects in iRoad, where active public participation was there. And you can see there's a box which we call as the grievance redress complaint boxes, which are put in every road developed under the project. So the problem especially erupted with the Western province, because Western province was the last province to be mobilized, and it was affected by the COVID pandemic. So the basic challenge was how to make the public aware of the project and how to establish the grievance redress mechanisms. Because I have listed the key issues, because the public information or their suggestions are considered in the detailed designs of the program. So we need to get that feedback from the public, and there should be an effective way to communicate the grievances the public will be having when the project is implemented. Okay, so now the country went to a total lockdown during March, and it went up to end April, and the government wanted to open the normal work by end April and starting from like mid-May. So there was a hurried response. The contractors were to be mobilized, and some sort of guidance needed to be given on especially on taking protective care on containing the COVID pandemic spreading within the sites and in the project area. So one good thing was the RDA, as the implementing agency, they developed a good guidance document which was shared with the contractors, and SLRM also developed a guidance document. And as Flex told, one of the key points which we stressed was to do a HS risk assessment before mobilizing, and even to map out the places where you consider red spots or having a COVID noted places. Then a round of consultations through virtual sessions were conducted between the PICs, the implementing agents, units, the contractors and the consultants, and ADB SLRM was joined. And what we did was we wanted to develop a new way on how to conduct this community awareness and grievance committees, or establishing the grievance committees. So in basic essence, these precautionary measures were taken. Now you can see, what one of the key things was done was to aware the public on the health and safety guidance if they are to attend these awareness meetings. So that was done through using public addressing systems with the assistance of local police, as well as the Grama Niladhari, who is the village level administrative officer. Then at every site, it was agreed to have a register of the participants, and a temperature check was made mandatory. Then facilities for washing the hands, things like that were there included. And the other thing is, our country is more towards like helping people, and so this providing beverages and food items were restricted during these sessions. So taking these precautionary measures, a method was developed where the project engineers The project directors and the consultants first identified the real areas or the need areas where the consultations are to be held. So this was based on the contractors' work programs where they were to mobilize. But then again, this risk assessment was done, and if there were like red areas, they were not considered for going ahead with these consultations or awareness programs. Then once the time, date and venue was agreed, the information was shared with the local police, the health authorities and the Grama Niladaris. And the public health inspector was brought in before the meetings to verify or validate the available facilities, and if he was like convinced enough that the measures are good enough, then only the awareness programs are conducted. So just showing some photographs taken during the initial awareness programs, you can see that all the people were wearing face masks. And here I just want to mention, I mean, during the programs, we sometimes had to make aware the people on how to wear the mask, because some were wearing it below their nose level or even below the mouth. So we had to basically educate the people on using this. And you can see that hand sanitizers are available, and the distancing of 1.5 meters were maintained. So so in essence, what we did was we made sure that even with the COVID situation, the awareness and the GRMs were made available to the public in the iRoad 2 program. Yeah, thank you.
Thank you very much, Saranga, for this presentation, for sharing this example of what happened in the case of the iRoad 2 project. And I want to thank all panelists for their presentations today. I'd like to invite us all now to spend some time answering a few questions. I have had a quick look at the Q&A questions that have come in, and I would like to pose perhaps the first question to Eduardo and Felix. Perhaps one of the two can answer this first question that I'd like to raise from a participant, and that relates to setting up consultations with stakeholders in a COVID-19 environment, how to mobilize effectively. And I suppose that brings in a health concern, and I guess perhaps in a project sense, it would bring in a safeguards concern. So what would be your advice to executing agencies, to IAs, EAs, on how to conduct consultations with communities, with stakeholders in the field in this type of environment? I give you the floor.
Okay, maybe I would take it, and then the doctors will come in if what I'm saying is it sounds all rubbish, it doesn't work. I would say from the safeguards perspective, and by the way, this is the biggest problem. This is our biggest challenge across all MDBs, given that from the safeguards perspective, a lot of our work has to do with talking to people. The only way we ensure for projects to go ahead is to ensure that we've obtained what we call social license. And to get social license is to make sure people are informed about the potential projects, environmental and social impacts, and they are part in a form of public participation stakeholder engagement process in designing the mitigation measures that will prevent those things happening. Unfortunately, we have to maintain that physical distance. And that becomes then a challenge. There are travel restrictions. So safeguard specialists themselves cannot move in. Even within one DMC, there is a restriction from one region to the other. So it does bring a big challenge. There are two things I would probably maybe want to highlight here, which I think had happened. First of all, you use national guidance. So if national guidance says that you can go to a location, I think ADB, no matter how much we want to fund our projects, we still want to protect health. So for that reason, I would say you have to obey what the national legislation says. If there is a lockdown, either locally or nationally as a result in an effort to prevent the spread of the virus. I think we have to comply with that. The second is where lockdown conditions have been eased, websites have opened, then what we're saying is that you have to do a risk assessment. Saranga here was trying to explain or highlighted some of the risk assessment that they conducted on their side for them to engage in that public participation process. And that risk assessment would take so many factors into consideration. The spread of the disease in the area, availability of expertise to organize a consultation. Of course, even if it's a green, let me say red, yellow, or red zone, yellow zone, green area, and this is a green area, the incidence of the disease is quite very low. If you don't have the expertise to do the consultation, then it will still not happen. Okay, so that becomes a problem, and then we can even come down into the type of consultation you want to organize. If you want to organize a focus group consultation, face-to-face consultation, then what we're saying is you must maintain all the good international good health advice that has been issued. Use of respiratory hygiene, your wearing of your mask, maintaining the physical distancing, using sanitizing and what have you. Not maintaining more people within an area more than what is required by local guidance and international guidance. So there are a raft of things to look at for you to achieve what we call a meaningful consultation, because that is what is required in the safeguard policy statement. We say you must achieve a meaningful consultation. That notwithstanding, I have seen the increase of use of digital technology in consultation within these few months. For instance, in our PRC and our East Asia Operations Department, there's been a project that has used WeChat. WeChat is the social media platform similar to WhatsApp in many places. WeChat functionality in WeChat has been coded quite very nicely, and it has been able to achieve what I would say a comparable, meaningful consultation without organizing physical meetings. I even see some comparative advantages that it provided anonymity for people that maybe would not be very open to talk about things in a public gathering. They were able to air their views because of that use of that digital technology. So you could also consider the use of digital technology. But I know sometimes some of the work inevitably requires face-to-face. So I think those ones we can pack. That's the approach that ADB has adopted. We can pack those ones, and then when conditions evolve, things get better, we can go back to those projects. Those will be my earlier responses to that question. But it's a very, very difficult one, and it's a one that is being grappled by all MDBs, to be honest.
Thank you very much, Felix. And I'm wondering, Eduardo, do you want to add anything to that answer?
Felix, sorry, just a couple of points, okay? Anything that can be done virtually, do it. Because if you do it virtually, then you don't have to travel, you don't have to go to a particular place. Now, if it cannot be done virtually and you really need to do the consultations face-to-face, then you simply have to comply with a lot of the requirements now that will minimize close contact and close spaces when you travel and when you go to a particular place to do the consultation. So it can be done, but it will be quite a difficult way. So virtual for me is still the best way.
Okay, great. Thank you very much. So I'd like to ask the next question to Koichi. Perhaps I'll share, it's a situation question posed by a participant from Myanmar, and then I'm going to add another question onto that perhaps you can attempt to address both together. So the question in from Myanmar: a contract is awarded to a top-ranked consulting firm. However, the consultant considers that the current COVID-19 situation prevents mobilization of the project team as envisaged pre-pandemic and may affect its ability to perform its service as initially anticipated. They're also facing difficulties in mobilization. So how do we advise this participant in providing answers or advice to the consultant? So this is one case where the consultant says, look, we've just concluded the contract and I don't think I'm able to mobilize. I don't think I'm able to do what we have agreed. I'd like to sort of add one more question onto that in terms of what you think the contractual remedy would be if the contractor does not comply with the requirements to implement the COVID-19 health and safety plan. So in a case where, so two scenarios, one where the consultant is saying, look, I don't think I can do this. What's your advice to this consultant or firm? And in a second scenario, a contractor or a firm fails to comply with what we require to be done now in a COVID-19 environment. Thank you.
Thank you, Sherry. With regard to the first question, I think if the contractor or the bidder, the lowest bidder to be awarded, is able to extend the validity of the bid as it is, one possibility would be to wait until the situation improves and then award the contract to that the bidder, because the bidding process up to that stage is properly made, and one bidder was selected, the lowest bidder. The only thing that hampers the award would be the situation due to the COVID-19. If we keep this, if to freeze the situation at that stage until this COVID-19 improves, the bidding process can resume at that stage. So, but one problem with this possibility is that the bidder may not be able to do that because of the possible price impact due to the prolonged period. So it's up to the bidder's will and the employer's will to wait, if it is able to wait until the situation gets better. That's my response to the first question. And the second question about the contractual remedy. If the contractor, which already signed the contract that include the obligation to implement the COVID-19 health and safety measures, the one possibility in case of contractors not complying with that COVID-19 health and safety requirement would be to issue the engineer's instruction based on the general conditions of contract 3.3 in case of the PDIC book, which state the engineer may issue the contractor at any time instructions and additions or modified drawings which may be necessary for the execution of the work or remedying of any defects, all in accordance with the contract. And another possibility would be suspend the work if the contractor doesn't comply with the COVID-19 health and safety requirement. And this relates to the GCC 8.8, which state engineer may at any time instruct the contractor to suspend progress, part or all of the works. An engineer may also notify the cause of the suspension, and if and to the extent the cause is notified and is the responsibility of the contractor, the contractor's right to extension of time or additional payment of costs will not be applicable. So in case the contractor doesn't comply with the COVID-19 health and safety requirement, it is clearly the responsibility of contractor for the engineer to suspend the work, so contractor will not receive any extension of time and cost. So those would be the possible responses in case of non-compliance on the part of the contractor on the COVID-19 health and safety requirement. Thank you.
Thank you very much. And there are a couple questions to Jenny, which I think you may have just responded, and one of them is recognizing the issue of extension for time. Maybe I just repeat this one in case Jenny would like to add anything. The question is, on an existing contract, aside from the quantum, will be recognized an extension of time? Okay, I think the person is trying to ask whether extension of time will be taken into account in the COVID-19 pandemic situation. Do you have anything that you'd like to add on this?
I think I think as we mentioned in the briefing, probably we need to look at the facts and situations on a case-by-case basis based on what was the information provided at the time of the contract signing, and whether there's any new information that was not foreseeable after the contract's awarded, and then the engineer will take that into account in the claims or extension of time assessment. But I think one general point I would probably just quickly add is that that's, I think the situation described before about having some difficulty after contracts awarded in terms of mobilization is the situation we're trying to avoid by having sort of like suggesting that there's clarity in place in the procurement process before contracts are awarded, that the contractor will plan for a situation and also associated contract delivery risk in case there is any logistic or resource mobilization difficulties in COVID. So hopefully with these measures in place, those risks will be able to be mitigated.
Okay, great. Thank you very much, Jenny. I do have one follow-up question for you. In your presentation, you shared a lot about what are the new requirements and guidance from ADB in respect of remobilization and the requirement for the COVID-19 health and safety management plan. You also, I think, shared one or two slides on roles and responsibility, which participant in the process is required for doing what act. There is a question here that comes up on additional costs, which I will pose to you. You may have already addressed this in your presentation, but I will field it now. If the signed consulting contract is required to make an amendment due to COVID-19, will additional cost be borne by the EAIA, or will there be an amendment with no additional cost? I suppose too, as you just said, it could depend on the situation in each case, but I leave the floor to you and perhaps even Koichi if you want to comment on this.
I'll probably just quickly maybe reiterate the principle that we touched on in the presentation, and Koichi-san, feel free to add if you want to. So I think in terms of dealing with claims from the consultant on additional fee that might be required as a result of COVID-19, I think is similar to dealing with variation claims in a normal situation. You have to look at whether the scope of work and the information and conditions at hand at the time of contract signing has already the consultant should already have all of those arrangements planned for and included, and whether there's anything new that the consultant couldn't have foreseen, and therefore there's cost implication as a resultant of that particular context. So I think it really depends on exactly what the consultant's asking for. But for example, if there's things like maybe PPE and that sort of thing that the consultant are asking for, but they are site supervision consultant, you might want to consider, for example, that they would need to prepare PPE to go and visit the site normally anyway, because there's still a health and safety management protocol that they need to adhere to. So what difference does COVID-19 make? Without the actual situation at hand, is kind of hard to just give one size fit all answer, but I hope that sort of a little example might sort of like highlight things that people can think about. That would be my response.
Thank you very much, Jenny. I have a question from Saranga coming in. Okay, I'm not sure from where, but the question is, in the Sri Lanka I-Road project case, how is field level monitoring being conducted during the COVID-19 time?
Yes, now the consultant or the engineer has an environmental and social specialist, and with them they have their assistants fielded at what we call as a RE or regional engineer office level. And other than that, the project PMU or the RDA side also have their safeguard team who does the monitoring. So what happens is even during COVID, the information, I mean, the places where possible they had visited, but in the places with restriction using of video footage and photographs, they were able to get sort of a update on how the environment and social safeguards were implemented. Yeah.
Okay, great. Thank you. I would like to ask you a follow-up question in terms of the sudden lockdown in the country. How did it impact, or what kind of impact did it have on the prevailing safeguard measures taken at the construction sites, the requirement for sudden lockdown?
Yes, I mean, there was a impact on varying degree in different projects. Now, for example, another project funded by ADB is the Mahavali Water Security Project. And in that project, what happened was emergency environmental management plan was developed by the consultant and handed over to the contractors so that the contractors maintain a minimum staff at sites basically to look into the safety measures and attend to any sudden environmental issues if required. And a periodic update was given by the contractors to the environmental specialist of the engineer again.
Thank you very much. I see that we are already at 4:06, which means we have passed the time for our panel discussion at this time. I would just like to close with a few points, and I would like to say to the audience, thank you so much. There's so many questions that you have raised online here, which we cannot all take due to time. However, we will perhaps answer these questions after and share a Q&A response document. So many issues have come up. There are questions on the use of electronic systems. I see questions on public consultations in terms of the health and safety aspect of reaching out and having stakeholder consultations. One of the participants is asking about a project that requires access to more than some 5,000 residential lots in terms of, conducting public consultations, and they're wondering how do we do this safely, and how do we find another way. I know that Felix and Eduardo did mention using electronic means, virtual meetings as far as possible. But we do know in reality, in some cases, it's going to be difficult to reach everyone. Not everyone has access to electronic systems. We've seen questions on field work and fielding international consultants, a request for increased use of national consultants. I've seen points being raised on how difficult it is to approve the health and safety plan if an EA or IA is not experienced enough in terms of what ought to be included in the health and safety management plan. And they're asking, well, what is the role of ADB? Can ADB do more for us in terms of reviewing or making some sort of prior approval on the health and safety plan? I know this is a tricky point, but certainly it has been raised here, and we will do our best to answer these questions and make the responses available to you. We will also try to make available all the presentations that have been delivered here today. And in this respect, I want to thank all our panelists who have joined us today. Thank you for taking the time out to present. We saw how interrelated and interlinked your topics are, and no doubt the organizers of this conference put you together for good reason. The procurement, what goes inside it, the legal implications, the health and safety issues, the current state with the pandemic, the safeguards, and of course examples of what is really happening in the field. So I want to thank you all for joining us today, for taking the time out to present, and I want to thank all the panelists. All the participants who are with us, who've stayed with us, who came back this afternoon and participated to make the first day of this forum very active, very dynamic. So with that, I leave you. I thank you all, and we will see you again tomorrow. Good afternoon.
Thank you for participating in this session. We will resume tomorrow. We hope you use the time to network with other participants in this forum. We've also prepared a game to make learning and networking fun and useful for you. Go to the Games and Quizzes page to access it. And don't forget to post your key takeaways from this forum in social media using the hashtag #RiseBeyondCovid. See you back online tomorrow at 10:30 a.m.